I have been working in pediatric oncology in a pediatric oncology unit here in Gothenburg for many years. But after my PhD, I transferred my job to start working in the long-term follow-up clinic for children over 18 having had childhood cancer. So that's where my position are now, and I do some research part-time as well. So the talk I'm going to talk about it's a little bit, mostly about my experience as a nurse clinically at the pediatric oncology unit and my thoughts on physical exercise during the time there. So what I would like to focus a little bit about in the beginning is the parents' view, because the parents influence not only the small children, but even the adolescent children. So parents' beliefs about cancer when they come to the oncology unit, it's a lot that they have thoughts about that cancer is equal with death. Cancer will cause, what causes are there any causes that my child gets cancer? And they think about when you have cancer treatment, you get really tired and it's a lot of fatigue and you lose your hair. And it's really that you have to isolate yourself so you won't get infections. Those are beliefs that parents have before they come to the unit, could have. But parents also want to protect their child. They want to protect them from harm. They want to protect them from infection, from malnutrition, from getting tired. They want to protect them from being behind in school. But um, school and social life, I think it's a part of physical activity. So if a child who gets cancer are allowed and are pushed to get back to a school, get back to friends, get back to social activity, I think they will be more physically active. But if you read papers that's been researching this, that child with cancer are being back to normalcy if they attend school, if they socialize, they feel like it's more a normal, that they are a normal life. And social life is also important for relationship during cancer treatment. And it's important for us to foster that, to make it important as nurses, that your friends are still very important to you. And children who are undergoing treatment, they report in previous paper that play and leisure activities and socializing with friends promote their well-being. And here in Sweden, we made some, now it's in Swedish, you see, but we made some guidelines for social life. So we have a national guidelines for this that encourage children to go to school as soon as possible after diagnosis and not being held back and isolated in the home. And we promote that and we talk about how important it is, and that most infections the child will get from themselves and not from others. So we try to encourage them to be with their friends and to be back in school. So what can hinder these social life? Children with undergoing a treatment for cancer, they experience fatigue during certain periods. That is, we know that. And when we inform patients and we say, we use expressions like, well, she and he can do as much as he can manage, then the parents will think that no, he cannot manage this. He's too tired. He needs to take a rest. He shouldn't go out play soccer or football. So what I think we should ask ourselves, who should determine if the child is capable? Today at the Paediatric Hospital in Gothenburg, we try to promote activity of physical exercise and activity from the start. So we have physiotherapists. We don't have exercise therapists or private trainers and so on, but we have physiotherapists, and they are seeing every new child at the unit and promote to keep on doing their exercise that they are used to, or try to teach how to, like what you're doing in this project, I think, try to make them play, try to make them move. We also have play therapy that we promote them to go to during treatment also. We know that parents, they are sometimes, they think sometimes that it's better for a child to, when they have treatment and they are tired, it's better to rest to be better, better to lay down in the bed to get well sooner. And then we need to uh, shift this thinking and talk about that activity. It's not dangerous to be active. It's not dangerous to have exercise. It's not dangerous for a child to play football. I met a boy who was 8 years old, and he had leukemia, and he played ice hockey, and he had about 3 hours drive to the hospital. And we talked about it. It's okay to have exercise. So every time he went for a week of treatment, he went to his ice hockey club and went in to put on his ice, how do you call them, the equipment, and he went out on the ice and he played with his mates. And then he went to the side and he threw up because he was sick after the treatment, and he drank some, and then he went out on the ice again. So he was joining his team the whole treatment, and he was feeling very well and very good. And that was kind of, I think it was 10 or 15 years ago. So we was really ahead of his time. So we try to, so we have some, yeah, these are some information for parents about that it's not dangerous to be active. So what can we do as a nurse? We can collaborate with parents to create a daily activity plan. We need to facilitate play during medical procedures and to promote to be active. And maybe we can also encourage patients to be active and assist nurses to bring the blood samples down to the laboratory and come with us with this and that. And we also need to promote the participation of teenage patients to have friends coming to hospitals, because if the friends are coming, usually the teenager are getting up from bed or moving more and doing things together with their friends. Finally, I just want to shortly talk about the long-term follow-up clinic where I work, where we meet children today who had cancer 5 or 6 years ago, at least, or maybe 20 years ago. And when they had the treatment like 15 or 20 years ago, we had a different view on physical activity. And we meet some patients today that are 25 or 30 years old that's never been into physical activity because their parents were so afraid that they were, so they had to be careful. So they struggle to be starting to have a physical activity in their lives. This is and so we work a lot of promoting healthy lifestyle and then the benefits of physical activity. And in Sweden, we also have something called prescription of physical activity, that they can be prescribed physical activity, and then they can get some discounts on gyms and other activities. Thank you.